everyone. Welcome back to the Grow RDH podcast. My name is Katie, and I am a dental hygienist from South Dakota, and I'm going to be your host today. And today we are going to be talking about ozone therapy, and we're going to stick on that perio theme. Just to remind you, if you're new to the podcast, welcome. We talk about all things dental hygiene, I guess. This is more of a casual conversation. We're just talking about things that are interesting, I guess, and things that are new and things that, just impact our day-to-day life. And recently we've been talking about perio-themed topics, and that is leading up into a perio workshop. So I have a perio workshop coming up July 13th. It's going to be super fun. We're going to be working 2 different cases. So we're going to be talking about staging and grading and the process of staging and grading. And then we're going to be talking especially a lot about CAL and calculating CAL, making sure we're all doing it right, no matter what our softwares do. So the last few podcasts, we have been leading up to that in sort of a perio theme. So we're going to continue on that theme today. But if you're new here, that's sort of a little bit about this podcast. If you are a return listener, thank you so much for coming back and listening. I appreciate the support. If you are liking these podcasts and find value in it, please like and subscribe. I am posting these on YouTube and Spotify. So that's where you can find all of the other episodes and the perio stuff that we've been talking about. And last week, I just want to send a big shout out thank you to Joyce. We had our first interview, Joyce Ducat, and she talked about her company, Professional Learning Services, and sort of how she got there and her professional journey. It was just a really great conversation. So please go back and listen to that because it was a really great interview. So thank you, Joyce, for coming on the podcast. I appreciate you. And thank you all for listening and supporting. Today, we're going to talk about ozone, as I said, and this is a new setup, right? So if you've been watching me for a while, welcome to my living room. I have been in chaos. I'm sure all of you know exactly what I'm talking about. It is summer, and my kids' schedules are crazy. We have softball, I golf league, and been working, and this week has just been nuts. And I was going to actually record this podcast last night. It is Friday morning, and so nothing like getting it in at the last minute, but this is my living room, and we are here because all 3 kiddos are in my bedroom right now. I could not get it done last night. One would trickle in, and then the second one's kind of curious what I was doing. They wouldn't go to bed. They were wound up tight from swimming at the pool. And so here we are. This is life, right? Mom life. And it's just part being flexible and going with the flow. So that's what I'm doing, going with the flow. Okay, so we're going to get into it. Today we're going to talk about ozone. The reason I wanted to talk about ozone is because one of the dentists that we are working with for our laser research is also super into ozone and has been using it for a while. So I got a little bit curious about it. I wasn't familiar with it, and I wanted to do just some research on it, look up some articles to see what it's about because I'm not super familiar with it. And I did a deep dive this week trying to find some articles, and I did find really good 2 really good open access articles that I can link in the description notes. One of them is an empirical study, an actual study done on stage 2 and 3 perio, and then one was a lit review, and in the lit review, all of the studies in the lit review were done on human patients as well. And so that was important to me. A lot of the research out there is in vitro, and not that it's bad research, but it is sometimes not super helpful or practical to look at that research when it comes to how does it help us with patients, right? So I wanted to really find good articles that were about human patients. And I did. I found 2 good ones. So I'm going to link them so you can read the articles and see what you think. First, I want to talk a little bit about what ozone is and how it works, why it's good for patients, and then the 3 delivery methods. So should be a fairly easy podcast today. Hopefully you can take something away. I'm really interested to hear who all out there uses ozone already And if you are using Ozone, please comment, because I'm super interested in hearing your perspective and your clinical experiences with it, to see, are patients accepting of it? Is it something that you are really seeing a lot of good results with? And so, yeah, please give me a shout out if you are using Ozone. So first we'll talk about how Ozone works, going all the way back to chemistry, right? So ozone is a molecule just of oxygen that has 3 oxygen atoms. And because it has 3, it's super unstable, which makes it a good oxidizing agent. Basically, it's going to decompose really quickly, because oxygen O2 in that form is pretty stable. But when you add that 3rd oxygen, it becomes unstable. And because it readily accepts electrons from other molecules, that's what makes it a good oxidizing agent. And from what I've read, oxidizing agents have been used a lot in the medical arena, in the medical field. And so today we're going to be talking about it in Perio specifically. And so what happens is when ozone reacts or is around other molecules, like I said, it readily accepts extra electrons. And so when you put them around a bacteria or a virus, it's actually going to disrupt the cell structure, because when it loses that electron, and that electron, or not the electron, it loses that other oxygen atom. That oxygen atom is looking for other things it can bind with, right? And so it actually causes structural damage in the cell walls and membranes because of the chemical reaction there, which is really kind of cool. Another benefit is that when it does that, it can actually create reactive oxygen species, such as hydroxyl radicals, which would be OH, or hydrogen peroxide. And those are created during that oxidation process. So when we have those reactive oxygen species, it actually causes oxidative damage to the cells and disrupts their metabolic process. So what does that mean for us? Basically, it has really strong antimicrobial properties, and that's because it can penetrate and really disrupt the biofilm well, which is what we want, right? We talk all the time about biofilm and reducing the bacterial load for the patient. So if we can do that with something that's very non-invasive, sorry, it's 6 a.m. So if we can do that with something that's very non-invasive and something that patients can accept, that is just a wonderful addition to our SRP. So there's other things that it does besides that, right? So it damages the structural cell walls, it disrupts the biofilm, and it reduces the bacterial load. Because of those things, there are some outcomes that happen, right? So ozone can actually help reduce inflammation by decreasing the amount of pro-inflammatory cytokines, right? Those are the mediators that initiate inflammation. And it can increase the anti-inflammatory cytokines, which the anti-inflammatories, right, help us reduce our inflammation. So if those are increasing, we're going to have more anti-inflammatory mediators circling our mouth. It also initiates the release of growth factors that stimulate tissue repair, which is great because as that inflammation goes away, we also need to rebuild and repair. And that is what's going to give us that reattachment, like the junction epithelium. That's what we're looking for. So that's super helpful. And then finally, increasing the oxygen available in our tissues can actually promote really healthy cellular metabolism. And when we have good cellular metabolism, we're going to get faster healing, and it also can improve our circulation in those areas. So all of these things, right? All of these things really add up to really good healing. and reduction of bacterial load, which if we think about a lot of the things we do, even irrigating with our ultrasonic, that is the goal. And that's what we're looking for when it comes to getting patients good outcomes after SRP. So we want to understand how it works and why it's beneficial. So how do they use it? In the clinical application, there are a couple different ways or delivery methods, I guess, that you can use ozone. And the first one is water. So ozone water is water that has these ozone molecules in it, right? So for us, that is probably the easiest one to incorporate because we use water all the time. And the main thing we use water for is irrigation. So if you're using ozone water in your irrigation process, you're actually just putting that water right down in the sulcus. And that is one way that offices can implement ozone is the ozone water. So the second one, though, I find interesting because when we talk about topical application of medicaments, we think about like Oracix, where we're putting that topical anesthesia in there. We think about Arrestin or Atrodox, where we're putting that antimicrobial down in there. And, Arrestin is like the powder, Atrodox is the gel. And so what they have for ozone is an actual ozone gel. And I'm thinking, I've never used it, full disclosure, but I'm thinking in my head, like the ozone gel would be very similar to Atrodox, because Atrodox is that gel and then it sort of hardens up when it gets down in the pocket. So when they're using ozone gel, they actually insert it directly into the pocket for topical application. And again, if you've used it, please let me know. I want to hear your experiences. I'm going to be looking into getting some ozone gel so we can experiment with it in the lab and just see how it sticks in the pocket. Does it stay down in there? Are you seeing really good results in those pockets that you're healing? And then finally, the other application method is a gas. And again, I've never used it. This one, I was like, this is a little tricky to understand. So I did some research. I read some articles and I read some even websites of dentists that were using it. So, but the gas looks a little bit trickier. So dentists either inject the ozone gas into the affected areas, or they expose the patient to ozone steam, which I found super interesting. I'm picturing like a spa, like a sauna, right? And so the ozone steam is exposed in the mouth. So I have never seen it done. But if any of you are working for dentists that are doing this, I would love to hear the process. Please reach out because I'm so curious. But when I was reading about the ozone steam, up until the steam part, I was not reading any negative or adverse reactions. But when I got to the steam, a couple of the websites, which they're not reliable, right? We don't know. Those are just websites. They're not science-based. They're just experiences. But in some of the verbiage on those websites, they were saying that ozone steam can cause a little bit of discomfort, especially like the day after. So that would be something to sort of be aware of, right? So why would we want to pick ozone for our patients? And like I just said, from the research that I was reading about, it sounds fairly non-invasive. So if it's non-invasive, that means the patients may be more susceptible to trying something like that, especially if it's really easy to do and easy to apply and can offer some potentially really good benefits. Similar to laser therapy, right? We do not use it on its own. Just like laser, just like Atrodox or Arrestin, none of these things we're going to be implementing without SRP first, right? But it may be something that's a little bit more easy to implement than, say, a laser because it's maybe more cost effective. and say, you're looking at different adjuncts, like what can we add? We need to supplement our SRP with something. This may be a little more approachable because it doesn't require a certification like the laser does, and it may be more approachable financially. So that's something to think about too. And of course, if they're already coming in for SRP and this is just an added boost to reduce inflammation faster, it may be a good option for those who are looking for something. Like we know, Arrestin, Atronox, that's also a pretty big financial burden on a patient. So if this maybe is something a little more affordable or a little more accessible, they might be more willing to do something like this first, just to try it. From the literature and things I read, I couldn't really find much for patient acceptance in terms of, compared to other adjuncts. There's no research out there looking at that. But I'm just wondering for personal experiences if this would be more acceptable. But research to come, right? Also, for patient discomfort, like I said, there really was none for ozone water and ozone gel. There was no reports of patient discomfort on those applications, but for the steam, there was a little bit of patient discomfort after. But overall, the water and gel method seemed to really have no major side effects at all. So, to summarize, ozone therapy seems to offer a promising adjunctive approach to managing perio, which is awesome. And just to summarize from the beginning, it has antimicrobial properties and healing properties to improve oral health outcomes. And that's what we're looking for. So if you or someone you know is using ozone, please let them reach out to me. If they want to come on the podcast and talk about their personal experiences using ozone, I would love to hear it. And in the meantime, we're going to be continuing to talk about perio adjuncts. I'm not sure which one we're going to talk about next week, but I guess you'll have to tune in to find out. Thank you for listening, and thank you for being flexible about watching me in my living room. I appreciate your support. If you like this podcast, please like and subscribe, share it with a friend, and comment. Get involved in the conversation. I would love to hear your experiences and continue to spread this good information. Have a great Friday, and I will see you next Friday.